All right, Mr. Peter, I think we are live.
Hello, Miss Sharon Gill. Pleasure to be here.
Peter, you are one of our most loyal supporters of Tea Talks. And so, what better guest for us to have on than you? And you're, of course, for those of you who will be watching the replay and who've missed this first part, Peter is also a team member at Total Health. It's
Yeah,
one of our
relatively new team member.
relatively new. Peter, you keep saying you're new, but we kind of started at the same time almost. I mean, I came on last August as the outside coach, but you were already there, I think, 2 weeks.
Yep, yep.
when I
And well, I've known Sarah too for since 2017. So we go
Yes,
back. Yes.
yes.
So I do feel like part of the Total Health family, even though I'm newly into the Total Health family.
Well, you're definitely family, and so today we're going to talk about changing directions in oncology medical education, and
Yep.
so.
Well, that's a topic where I feel like I'm changing my direction with medical education. Yeah. With the medical education that I've been doing. So,
Well, let's talk about your direction. How did you get here at Total Health? What's your background and how did you end up at Total Health?
well, I probably should talk about my direction. How did I get into medical education first? I was actually on a career path to be a scientist
Oh,
in
okay.
cancer research. Yes. So I did my bachelor's at Brooklyn College in New York. And then I did my PhD and my master's and PhD at NYU Medical Center in New York. And I also did a postdoctoral fellowship for 3 years in New Jersey at the Center for Advanced Biotechnology and Medicine. And at that point in my career, I loved doing experiments. I loved being in the lab. I worked with amazing people and very interesting projects that I was working on, but I didn't see the future in biomedical research. I didn't see my future as an academic person, being hustling for grants or being a faculty member at a major academic center. And I also did not see the future in research in an industrial setting either, because that was the other option. It was kind of like academics or industry. So the way I got into medical education was Sarah and I have a mutual friend, and actually her roommate at the time when she was a graduate student in my postdoc advisor's lab was doing medical education with a company in New York, a medical education company in New York. And so I wanted to do something where I could apply the knowledge that I have and but also not be in a capacity where I'm doing research.
Mm-hmm.
Which, I mean, as I said, I like doing experiments. I didn't like being a researcher. I didn't like thinking too much outside the box, which is what every good scientist must do. I didn't like it when my experiments didn't work out the way I thought they were supposed to work out. And a good scientist has to think outside the box. And so that was, I think, that's my rationale to why I never ended up going down the career path of being a scientist. I went into medical education instead.
Okay.
And I will fast forward that to shortly thereafter, my wife at the time and I moved down to Florida. And I decided that I wanted to start my own business in medical education as a freelancer to work with medical education companies. And let me kind of explain what medical education is to the non-field person. Medical education companies kind of fill a role between pharma companies and the public or the physician community. So often if there's a drug coming out for a new indication, or they're getting the message out about a new drug that's coming out, they obviously want to get that out to the physicians, but they also want to get it out to the public. So there's a pretty a lot of steps that go into that kind of medical marketing process. So that's kind of where I come in. It's like I've worked the gamut of all types of review articles, clinical studies, slide kits, product monographs, clinical study reports, also creating materials for the pharma sales team to educate them to go out and market to the doctors. So that's kind of what I view as like kind of the old style medical education, and it's an important field. It's a big process. Like the med ed companies really coordinate very elaborate publication plans and marketing plans for these different products that they're bringing to market. So that's kind of where I came in, is that I was a freelancer for the medical education companies.
So tell us about your work at Total Health. How is that? Because it's a little bit different, right? What we do there. How, explain how you help us.
Right. So, as I said, what I was doing I was doing that for 25 years. But I started I took on Total Health as a client about 2017. And one of the first projects that I worked on was dealing with, working with an expert group, a group of breast cancer therapy experts. And I mean, I knew all these names because I had worked in oncology for some time. So these were big, world-class names in the field. And I was in a room with them, and they were talking about, the topic was about endocrine therapy. And it was my job to assimilate that discussion and write it up into a publication. So that was one of the first. So it was really kind of, it was a totally new thing for me. And it was really exciting because this is like some real cutting edge stuff that they were talking about. And I was dealing in a room with, some of the top breast cancer experts in the world. So that was really exciting for me. And we have since repeated that process 6 times over with other expert groups. And now those are a part of the Total Health publication plan. So I knew Sarah as a client, and even some of the other stuff that the other type of work that I was doing for her was just so different from the stuff that I had been doing that I was very interested in Sarah as a client. And it kind of took my thinking about my business. It took my thinking about medical education in a different direction. So when the opportunity came last year to work for Sarah on a permanent basis, I was very much on board with the idea.
I feel some similarities there between you and I. So as you know, I came on board first, working with the team right. as that team trainer, coach, whatever. And just like yourself, right, you get exposed to all the magic that Total Health is doing, all the ways they're trying to impact this oncology community. And so it's kind of hard to say no when she asks to come on board, because it's almost like saying no to something that's so purposeful and meaningful, right? So
Sarah is also very, very enthusiastic and very charismatic.
Yes. So Peter, you get exposed to all of the cutting edge conversations, like you said, right? So what's exciting
through the Total Health programs, yes. All the conferences that we run. I mean, this is the latest and greatest information that's coming out of these meetings. And again, the faculty are just incredible. They're, world-class experts on the topic. So I get exposed to a lot of different hot topics in oncology. And one of the things that we do, one of the things that I've done with Total Health specifically is kind of putting all of that information from all of these excellent conferences that we have into kind of a little summary. This is a little bit different than, it's not quite physician focused, but it's more designed it's kind of like a plain language summary, we call it. Yes. But it's sort of like mid-level language to get the patient a little bit more interested and involved in their care. Because I mean, cancer patients, when they get a diagnosis, they're bombarded with information. So
Right.
I mean, what the summaries are designed to do, and there's a whole blog of these summaries on our website. What they're designed to do is get the patient asking questions with their clinician, or just to be engaged in a conversation with their clinician. So if there's a clinical trial that the clinician thinks would be of interest to the patient, they can ask questions about it. They can start the conversation, and they don't have to understand it all, but they can understand enough to ask intelligent questions and make more informed treatment decisions.
Well, I know for sure that the team at Total Health enjoy, we enjoy reading those summaries because we get to learn. And one of the things that we're doing of late is having you actually take over one of these meetings and breaking it down even more for us, because we're in the cancer space. We're not all scientists like you and even Sarah, but we're out there and we're part of the conversation. And so we want to be informed. So what you're seeing, again, cutting edge stuff, what is exciting you the most right now in the field of oncology? I'd love to hear your top two, your top two.
There's so much going on right now that's really just cutting edge research, and we get to hear about all of it with Total Health at the conferences that we have. But one of the things that excites me the most is multi-cancer early detection, MCED. It's sometimes abbreviated. But basically what that is like, think about the prospect of, we all think about, as we're getting older, we think about cancer, right?
Right.
And so, some of the cancers have screening available, but most of them don't. Actually, the majority of the cancers don't have any screening available. I mean, we know about mammography, we know about colonoscopy, but a lot of cancers don't have any screening for them. So think about the prospect of, you go to your yearly physical, and we all want to know that we're healthy, right? So I mean, think about the prospect of soon. I mean, the technology is not quite there yet, but soon you may be able to take that simple blood test every year to say, hey, you know what? You have cancer, or no, you don't have cancer. And before, so you're detecting the cancer before you have symptoms.
Yes.
Before you have to have some invasive biopsy of anything you could, or any type of screening that they may or may not have to act upon. I mean, you can know whether or not there's cancer in your body, and if so, where is that cancer likely to be? So it could be a follow-up to have, if, for example, lung cancer is suspected, there's low-dose computed tomography that can be done to identify cancer at earlier stages when they're infinitely more treatable. So even before you're developing symptoms. So multi-cancer early detection would be one of my hot topics that I'm very excited about.
That, I'm gonna be honest with you. I had no idea what that meant, but now I get it. And I remember listening to Dr. Jason, I think it's Porter in Memphis, and he was talking about, lung cancer screening. That's
what I didn't know, and this is important for a lot of people to know.
Yeah.
It's what he says is that we most think about lung cancer, we think about smokers.
Okay? Right.
Risk factor, right? I watched my uncle die of lung cancer, but he's a smoker, right?
Right.
But what Jason Porter says is that Dr. Jason Porter says is that anyone with lungs can get lung cancer.
Yeah.
And it's true, because I think it's 20% is the exact number. 20% are non-smokers. 20% of lung cancers occur in non-smokers. So you're not thinking about lung cancer, right?
Yeah. No, you're right.
Oh, I never smoked. I'm not thinking about lung cancer, so why am I going to get screened?
Yeah.
And the screening itself isn't even indicated in people unless you have a history of smoking.
Yeah. There's a woman that I follow in the faith world. Her name is Priscilla Shirer, I think her name is, and Shirer. And she developed lung cancer, and her mom passed away from this rare type of cancer with the lung. And she also had this cancer in the lung. And I know that woman never smoked. And she had a biopsy, I guess, some kind of a surgery recently. So when Jason Porter said, if you have lungs, you can have lung cancer. It was very eye-opening for me because there's some cancers you think you can never get, right? But again, the education is so key, which is why I really love what we do, because we are truly educating people. What's your next top breakthrough?
Oh, I think I would say immunotherapy, and we're going to be discussing this at our next meeting. In our team meeting, I'm going to be going over the topic of immunotherapy. Immunotherapy, simply put, is getting the body's own immune system to fight cancer, to fight the cancer. So, I mean, think about that. It's, you're not necessarily taking all these toxins into your body like you're doing with chemotherapy or with radiotherapy. And this has been kind of game changing for a number of cancers, including lung cancer. But another cancer where immunotherapy has made a huge impact is in melanoma. And actually, I know a guy who's very involved in immunotherapy with melanoma. I'm not going to mention his name, so I'll keep that as a teaser.
Yeah, okay.
But who knows? Maybe I can get in touch with this guy and get him on for a tea talk, or maybe at one of our meetings.
Okay, sounds good.
I'll leave that out there as a teaser.
Well, I am looking forward to the immunotherapy conversation because I, again, as a survivor, believe that our bodies can do more work. And this is part of my own personal philosophy on that. So I'm very excited about those breakthroughs. So Peter, Tea Talks, we want to leave the audience with something that's uplifting. And because you work in the space of breakthroughs, what can you leave the audience with? Like, hey, hang in there, because what?
Well, again, I'm big on the whole multi-cancer early detection. It's something that I think about every time I see my doctor. Is like, is there any screening that I should be doing? But as I said, the technology is not quite there yet, but it's getting there. So I think the prospect of detecting cancers earlier, with a simple blood test, as opposed to anything more involved. I mean, I think that's something that the world is going to get on board for.
Absolutely.
So, I like the prospect of being able to detect cancers earlier when they're infinitely more treatable.
Yeah.
That's would be something that I say, hang in there, because the technology is coming. And beyond that, I mean, the incredible breakthroughs that we hear about in so many different cancers.
Yeah.
And we get to hear about those all the time at our meetings. So, I mean, it's very encouraging to see. But there are also those cancers that we're still struggling with to improve people's survival with, and still a lot of cancers, especially lung cancer. People are diagnosed late, and but for the vast majority, there's been some really astonishing breakthroughs, and that are really helping people to live longer with cancer. I mean, a lot of times people talk about, instead of making cancer instead of cancer being a death sentence, clinicians often talking about it can be a chronic disease. Like we can manage it, like you have cancer, but we can manage it, or we can keep it in check so that it's not something that, and those are therapies that are really, they exist today. And there's more coming every single day.
That is so encouraging. And, I'll just say this, Peter, we talk about cancer on Tea Talks, and someone might say, geez, it's all they ever talk about. And but I just want to say the reason why we talk about cancer is because it is prevalent, right? And we've heard the statistics, whether it's 1 in 3, 1 in 2, whatever you want to believe, it's there. So we are
touch somebody in your life.
It is. And we are trying to get ahead of it and bring you, the audience, cutting edge information in the hope that you will find hope in the conversation, not to discourage or depress you, but to give you hope and to help you to be able to advocate for yourself as the doctors, to ask better questions, to ask about research, to ask about clinical trials. And we have more coming. So stay tuned. Stay tuned. All right, guys, until next week, We're signing off, but thank you so much, Peter, our #1 fan for the show.
You.
Thank you for sharing.
My pleasure.
All right.